Are you over 60 years old, and have you noticed that your erections are no longer as firm as before? Do you wake up without those morning erections that used to be completely normal? Do you feel that desire is decreasing along with energy? Listen very carefully, because what you're about to discover can transform your intimate life and your overall health. I'm Dr. Evelyn Carter. I'm a urologist specialized in male sexual health, and today I'm going to reveal something that most men are completely unaware of. It all starts with something as simple as what you do right before going to sleep. This is the warning I need to give you. If you don't do these things before going to bed, your body will start disconnecting from your sexual potential. And it's not because of age, it's because of the accumulation of small mistakes that go completely unnoticed. Let me explain something essential that few doctors tell their patients. What really happens to your body while you sleep? During deep sleep, especially in the REM phase, the body activates a series of vital processes for its regeneration, and one of them, perhaps the most important for your sexual health, is the production and maintenance of spontaneous erections. Yes, even if you're not having sexual relations, even if you're not thinking about anything sexual, your penis naturally activates while you sleep. This happens between 3 and 5 times per night, completely automatically. Why does this happen? Because it's your body's natural way of keeping erectile tissue healthy, stimulating proper circulation, promoting oxygenation of the penis, and helping to preserve sensitivity and sexual performance. And what happens when these nighttime erections start to disappear? The tissue begins to atrophy slowly. Blood flow decreases progressively, the elasticity of the cavernous body drastically reduces, and the risk of permanent erectile dysfunction significantly increases. And this can happen without you realizing it, in absolute silence, night after night, until one day your body simply no longer responds the same way. If this topic is important to you, write a 1 in the comments. If you know someone who needs to hear this, write share. Let's begin. So, what can you do before sleeping to prevent all of this? Here's the key that practically nobody tells you. I'm going to give you 4 fundamental rules that you need to apply every single night without exception. Rule number 1, eat dinner at least 3 hours before going to bed. This is absolutely critical, and I'm going to explain why. Eating heavy or very close to bedtime completely blocks proper blood circulation. When you lie down with a full stomach, your body concentrates all its energy on digestion, not on sexual regeneration. This drastically reduces the production of nitric oxide, which is the essential molecule that allows erection. Without sufficient nitric oxide, no matter how much you want it, your penis simply cannot get firm. And if you also consume alcohol or sweet foods at night, the effect is still much worse. I had a patient, Mr. James, age 67, from Chicago, who always ate dinner at 10 at night and went to bed at 11. Heavy food, beer, dessert. He came to me because for 2 years he hadn't had morning erections and started having serious difficulties during intimacy with his wife. When we changed only his dinner time to 7 in the evening without alcohol and without sweets, in 3 weeks he returned to having morning erections. Just 3 weeks. He called me emotionally, saying, "Doctor, I thought I had lost this forever." Rule number 2, avoid screens for at least 60 minutes before sleeping. The blue light from your phone, tablet, or television completely suppresses the production of melatonin, which is the hormone responsible for deep sleep. And without deep sleep, nighttime erections simply don't exist. It's impossible. Furthermore, the lack of quality rest generates chronic stress. And stress, my friends, is one of the biggest killers of male sexual desire. When you're stressed, your body produces excess cortisol, and cortisol directly blocks testosterone production. Rule number 3. Do this breathing exercise for just 2 minutes before sleeping. Breathe in deeply through your nose for 4 seconds. Hold the air in your lungs for 4 seconds. Exhale slowly through your mouth for 6 seconds. Rest for 2 seconds. And repeat this cycle 5 complete times. What does this do? It activates your parasympathetic nervous system, which is the system responsible for relaxing, repairing, and improving circulation throughout the body, especially in the pelvic region. You'll notice immediately how your body enters the ideal state for regenerative sleep and for nighttime hormone production. Rule number 4. Drink a glass of warm water or a natural infusion before sleeping. Your penis needs adequate hydration to stay firm. Many men don't know this, but nighttime dehydration thickens the blood, makes blood flow difficult, and can cause micro-injuries in erectile tissue. A ginger, cinnamon, or ginseng tea is absolutely perfect before sleeping. But attention, no added sugar. And above all, sleep at least 7 hours per night. Scientific studies show that sleeping less than 7 hours per night reduces testosterone by up to 30%. And without adequate testosterone, there is no desire or strength. In summary, if you're a man over 60 and want to keep your sexual potency active, don't wait for a miracle pill. Start with something much more powerful than any medication, your routine before sleeping. Because if you don't offer your body adequate rest, necessary circulation, and the correct hormonal environment, night after night you're losing something extremely valuable, your intimate vitality. And often when you realize it, you've already lost too much valuable time. Did you recognize yourself in what I said? Leave a yes if you already have difficulties with morning erections, a no if you want to prevent before it's too late. And if you learned something new today, write learned in the comments. Now let's go to the second part, equally important. The 3 morning exercises that reactivate blood flow to the penis in less than 5 minutes. In the first part, we talked about what to do before sleeping to preserve your nighttime erections. Now we're going to talk about what to do when you wake up. Because yes, what you do in the first minutes of the day can make all the difference between a day with active energy, circulation working perfectly, and desire present, or a day of deep tiredness, complete apathy, and weak or completely non-existent erections. Listen to this very carefully. The penis has no bones, but it needs constant movement, and not just sexual movement, but adequate body and vascular movement. Why? Because erections depend completely on blood flow. And if your blood is stagnant or circulates with great difficulty, there's no possible potency. Therefore, if you're over 60 years old and want to keep your virility completely active, these 3 exercises I'm going to show you now need to be part of your mandatory daily morning routine. The total duration is only 5 minutes, and results start appearing in just a few days. Exercise number 1. Pelvic activation, awakening the control center. This is a set of gentle movements that stimulate the pelvic floor, which is the muscular base that supports your bladder, your prostate, and your penis. How to do it correctly. Stand up with firm posture, legs slightly apart. Contract the muscles you would use to completely interrupt urine flow in the middle of the act. Hold that strong contraction for 3 complete seconds. Release completely and relax. Repeat this movement 10 times in a row. This exercise directly activates the pubococcygeus muscle, known as the PC muscle, which is the main one responsible for the strength and firmness of your erections and also for ejaculation control. Do this every morning when you wake up, even before getting out of bed if you prefer. I had a patient, Mr. William, age 72 from Boston, who started doing only this exercise every day. In 6 weeks, he reported to me that his erections became noticeably firmer and that he managed to better control ejaculation during relations with his wife. 6 weeks of an exercise that takes less than 2 minutes. Exercise number 2, breathing with nitric oxide, direct oxygen to the penis. Nitric oxide is an absolutely essential molecule for erection. Without it, the blood vessels of the penis simply don't dilate and blood doesn't arrive with the necessary force. How to stimulate this production in a completely natural way? Through deep and controlled breathing. Here are the exact instructions for 2 complete minutes. Breathe in deeply through your nose for 4 seconds. Hold the air in your lungs for 4 seconds. Exhale slowly through your mouth for 6 seconds. Rest for 2 seconds. And repeat this complete cycle 6 times upon waking. What does this do for your body? It drastically increases blood flow throughout the body, relaxes arteries and blood vessels, significantly improves your mental and emotional state, and there's an important bonus. It also reduces sexual anxiety and considerably improves performance during intimate encounters. Exercise number 3, leg flexion in place, pelvic pump for quick circulation. This is simple but extremely powerful. What do you need to do? Stand in a comfortable place. Keep your arms relaxed at the sides of your body. Flex your knees as if you were marching without leaving the spot. Raise each knee as high as you can comfortably, alternating between legs. Do this continuous movement for 1 complete minute. This movement drastically improves circulation in the entire pelvic region, activates lower abdominal muscles, and helps pump blood to the penis in a completely natural way. You can do this in the morning, right after going to the bathroom or while preparing coffee. It's so simple you can incorporate it into your routine without even realizing it. But the results, believe me, are absolutely visible. Important to make very clear. These exercises don't replace medical treatments when necessary, but they are an absolutely vital step for you to regain control over your sexual circulation. The sooner you incorporate them into your routine, the more profound benefits you'll feel. Firmer and longer-lasting erections, much fewer involuntary nighttime leaks, better ejaculatory control during relations, more energy and morning disposition. In summary, your sexual potency isn't lost suddenly overnight. It weakens gradually in daily routine. And if your routine doesn't include muscular activation, adequate body movement, and correct oxygenation, your body begins to disconnect sexually without you realizing what's happening. These 3 exercises aren't just physical, they're a powerful declaration of self-care. It's a clear message you give your body every day. I'm here, I care about you, I won't let you fade away. Are you ready to try starting tomorrow? Write active if you're going to do these exercises. Do it if you already have this routine. And write show me if you want me to demonstrate it on video. And now we arrive at the 3rd and final part. The 3 biggest mistakes that destroy your erections without you realizing it. You've done everything right so far, applied the nighttime rules, do the morning exercises, but you still observe that your erections aren't like before. You sleep adequately, eat, reasonably exercise regularly, but desire and firmness continue falling progressively. Then there's a strong probability you're making 1, 2, or even all 3 mistakes I'm going to reveal now. Mistakes so common, so normalized in society that most men don't even consider them a real problem. But believe what I'm telling you, these silent habits destroy your sexual vitality little by little. And if they're not corrected in time, recovery becomes increasingly difficult and prolonged. Error number 1. Using alcohol as a nighttime relaxant. Just 1 drink to sleep better. A glass of wine at dinner doesn't hurt at all, it even helps relax and rest. Yes, alcohol really can make you fall asleep faster, but what most men don't know is that it completely blocks the deep REM phase, which is exactly when spontaneous nighttime erections occur that keep your erectile tissue healthy. Additionally, alcohol significantly reduces testosterone, slows blood flow throughout the body, negatively affects the central nervous system, drastically decreases sensitivity and firmness. And most dangerous of all, it completely normalizes sexual disconnection. You literally shut down sexually without realizing what's happening to your body. So what to do? Replace alcohol with a natural and healthy infusion. Ginger tea with turmeric, warm water with fresh lemon, a calming chamomile infusion, or a relaxing tea with pure honey. Your body will thank you deeply, and your erections will also respond positively. I had a patient, Mr. David, age 68, from Houston, who drank 2 beers every night for over 15 years. When he completely eliminated nighttime alcohol and started drinking ginger tea, in just 1 month he recovered the morning erections he hadn't had in years. Error number 2, remaining hours and hours sitting, completely without movement. This is one of the biggest invisible enemies of male sexual life. After 60 years, many men spend most of the day sitting. in front of the television, at the computer, in the car during commutes, at the table after meals, in bed before sleeping. This not only drastically hinders blood circulation, but also severely compresses the pelvic region and significantly reduces blood flow to the penis. In other words, your own daily routines are literally atrophying your sexual potency without you realizing it. What should you do? Every 30 or 45 minutes maximum, get up and walk for at least 3 minutes. Do light squats or simple stretches. If possible, use an ergonomic chair that doesn't press the perineum. Movement is circulation, and without adequate circulation, there's no possible erection. Error number 3, and this is the most harmful of all, believing that sex automatically ends with age. This error isn't physical, it's completely mental, but it has a devastating impact on the body. Many older men sincerely believe, at my age, this is no longer necessary. I don't have a partner, so it doesn't matter. This is for young people. My body doesn't work that way anymore. And that thought, repeated in silence day after day, literally shuts down your libido. Your body continues producing desire, sexual energy, and adequate blood flow. But if your mind completely gives up, the body simply obeys and disconnects. Male sexuality has no expiration date. It only oxidizes and weakens when you completely ignore it. So what to do? Talk about the subject openly. Take it seriously as part of your health. Incorporate small daily actions that keep the connection with yourself alive. Conscious and respectful self-exploration, gentle massages in the lower body region, light but constant physical activity, genuine emotional or affective connection. Don't extinguish the sexual flame just because you can't see the fire at this moment. Sometimes what's really missing is simply the decision to keep that part of you alive. Final reflection of this complete series. Your erections aren't just about sex or momentary pleasure. They represent your general cardiovascular health, your complete hormonal balance, your vital energy as a man. Keeping them active and healthy isn't superficial vanity, it's dignity and self-care. After 60 years, every choice you make counts deeply. What do you do when you wake up in the morning? What do you do before sleeping at night? What do you eat during the day? What do you think about yourself? All of this is building or destroying your sexual potency daily. And today, you know exactly how to change that scenario. If this information resonated deeply with you, leave a yes if you're going to eliminate at least one of these serious errors. Write new if you already noticed something but didn't know it affected your erections. And comment "Want more" if you want a new series about specific foods, natural supplements, or advanced strategies for older men. Thank you for following this complete series with me. If you know an older man who really needs to hear this, please send him this video. He may not say it openly, but he really needs to know this information. Subscribe to the channel, activate the notification bell, and stay very attentive. Because in the next video, we're going to talk about daily habits that naturally increase testosterone after 60 years. And that, believe me, is a completely different level of knowledge. I'm Dr. Evelyn Carter, and your sexual health is a fundamental part of your power as a man. Until the next video.